Hi everyone, we are Group 5 together with my group mate, Nesreen Sanggutin, Marc Silongan, Nympha Sullano, Erich Timbang, Dyna Unson, Cielo Urbina, and me, Margareth Solimanan. We are now going to present our research entitled The Relationship Between Traditional Maternal Practices and Prenatal Care Decisions Among Pregnant Women aged 25 to 45 years old in selected barangay in Davao City. The problem addressed in the study is the lack of evidence on whether traditional maternal practices have any relationship with the prenatal care decisions of pregnant women. Specifically, the study aims to determine if such practices are related to the frequency of prenatal visits, timing of the first prenatal checkup, and choice of healthcare provider. This is important in the context of maternal health, as the World Health Organization reported 197 maternal deaths per 100,000 live births in 2023, while the UNFPA noted 189 per 100,000 in 2021, showing that maternal risk remain a significant public health concerns. Although global and national data have examined maternal health behaviors, the problem persists because there is limited research that looks specifically at how cultural beliefs, customs, and traditional practices may relate to prenatal care decisions among pregnant women aged 25 to 45 in selected barangays in Davao City. This research gap highlights the need to assess, without assuming any influence, whether these traditional practices have any measurable relationship with prenatal care patterns in the local community.
Statement of the problem. What are the traditional maternal practices observed by pregnant women in terms of cultural beliefs, customs, and practices? And what are the prenatal care decisions of pregnant women in terms of frequency of prenatal visits, whether it's regular, irregular, none, timing of the first prenatal checkup, if it is early, mid, or late pregnancy, and the choice of healthcare provider, whether it is doctor, midwife, traditional, birth attendant, or self-care? And is there a relationship between these practices and prenatal care decisions?
Conceptual framework, we have independent variable and dependent variable. In independent variable, traditional maternal practices, which is cultural beliefs, customs, and practices. And in dependent variable is prenatal care decisions, which is frequency of prenatal visits, timing of the first prenatal checkup, and choice of healthcare provider. Theoretical framework or theoretical lens. This study is anchored on Venera Kalikobas 2003 concept of medical pluralism, which explains how individuals draw from both traditional and biomedical system in making healthcare decisions. In the context of pregnancy, this means that women may simultaneously engage in practices such as herbal remedies, massages, or consultations with traditional healers while also attending prenatal checkups and giving birth in hospitals. This perspective emphasizes that these choices are not acts of ignorance or confusion, but rather culturally grounded strategies aimed at safeguarding maternal and fetal well-being.
Related literature and studies. Traditional maternal practices continue to shape prenatal care behaviors worldwide, reflecting cultural, spiritual, and social values. Practices such as herbal use, abdominal massage, food taboos, and reliance on traditional birth attendants persist because they provide emotional reassurance, cultural continuity, and accessibility. Yet, they may delay professional care and increase maternal risk. Studies in Ethiopia and Tanzania show that up to 50% of pregnant women use herbal remedies, avoid certain foods, or perform heavy work due to cultural beliefs, which can increase risk of infection, delayed care, or complications. Globally, maternal mortality remains high at 197 deaths per 100,000 lives births, with over 90% of deaths occurring in low and middle income countries. Delayed or incomplete antenatal care significantly raises maternal and neonatal risk, with less than half of women in some regions achieving the recommended over 4 ANC visits. In the Philippines, cultural beliefs, family influence, and economic barriers remain major factors in maternal health seeking behavior. Studies report that nearly 1 in 5 Filipino mothers still deliver at home, often consulting helots or panday for care due to trust and accessibility. Local research in Davao City highlights how traditional values and social expectations continue to affect prenatal care decisions. However, few studies have examined how these specific practices influence urban women's choices, particularly where traditional and modern healthcare systems coexist.
So for the method, this study uses a descriptive correlational quantitative design to describe traditional maternal practices and prenatal care decision and determine their relationship. It collects quantifiable data from pregnant women in selected barangays of Davao City to identify patterns between cultural practices and prenatal care behaviors within the community's cultural context. So for the respondent participants, this study involved 100 randomly selected pregnant women aged 25 to 45 years old residing in selected barangay of Davao City. The respondents were either receiving or not yet receiving prenatal care decisions. Participation was voluntary with only those who provided consent included, while women with high-risk pregnancies or serious medical condition were excluded to maintain focus on typical maternal experiences and cultural practices. So we chose whose age are 25 to 45 years old as the respondents because sila ang mas close sa mga tradition na gibilin sa ancestors. For research locale, the study was conducted in selected barangays of Davao City, a highly urbanized area in southern Philippines where traditional maternal practices remain evident, particularly in rural and pre-urban communities. Davao City provides an ideal setting for examining how cultural beliefs intersect with pregnant care decision, as it represents a context where modern healthcare facilities coexist with enduring traditional customs.
So, sampling design. Our study utilized a simple random sampling method. This means that every pregnant woman within our target population had an equal chance of being selected as a respondent. We chose this method to minimize biases and to make sure that our sample accurately represents the population of pregnant women in the selected barangays. A total of 100 pregnant women aged from 25 to 45 years old were included in the study. So all the participants were residents of the chosen barangay in Davao City. We focus on this age group because it is a typical childbearing range and reflect varying levels of experiences in maternal practices. We also set a inclusion and exclusion criteria to maintain the validity of the study. So only women with normal or low-risk pregnancy were included, while those with serious medical condition or pregnant women in a high-risk pregnancy were excluded. So since their prenatal decision might be guided primarily by medical necessity rather than cultural or traditional factors. So the participation was entirely voluntary and informed consent was secured from all respondents. In our research instrument, we use a structured survey questionnaire as our main data gathering tool. So the questionnaire was carefully designed to collect both demographic and behavioral information related to traditional maternal practices and prenatal care decisions. So it was also validated by experts to ensure clarity, reliability, and relevance. So the questionnaire consisted of 4 sections. First section is the informed consent form, which explains the purpose of the study, ensure confidentiality, and emphasizes voluntary participation. In section 2, it covers the socio-demographic profile of the respondents, such as their age, educational attainment, and pregnancy history, and also their household income. In section 3, it focuses on prenatal care decision using a categorical scoring format. For example, the frequency of prenatal visit is scored as 1 for regular, 2 for irregular, and 3 for none. And for the timing of the first check-up, the score 1 is for early, score of 2 for mid, and score of 3 for late. And the choices of healthcare provider as 1 for the doctor, and score 2 for the midwife, and score 3 for traditional birth attendant, and so on. And for the section 4, it measures the respondents' traditional maternal practices using a 5-point Likert scale, where 5 means always practiced and 1 means never practiced. So this section helps quantify how often cultural belief and customs are observed during pregnancy. So this structured format allows us researcher to collect quantifiable data that can be analyzed statistically. So the result will determine if there is a significant relationship between traditional maternal practices and prenatal care decisions.
Data processing. First, the researchers sought formal approval from the research advisor to ensure the study's ethical and academic compliance. Second, chapters 1 and 2 were completed to establish the theoretical and literature foundation of the study. And third, the proposal defense was conducted to validate the study's objectives, scope, and methodology. Fourth, qualified respondents identified from selected barangays in Davao City based on inclusion criteria. Fifth, an adapted and expert-validated survey questionnaire was used to gather data on traditional maternal practices and prenatal care decisions. Sixth, respondents were briefed about the study's purpose, voluntary participation, and confidentiality. Seventh, questionnaires were distributed both physically and online to ensure accessibility. Eighth, completed surveys were collected, encoded, and organized for tabulation. 9. The encoded data were submitted to a statistician for analysis and interpretation.
Lastly, the confidentiality of all respondents was maintained, with all records securely stored and properly disposed after analysis.